All right, let's get started. You may want to have your Kegelmaster with you so you can try putting it together as I explain the different pieces. When you open your box, you should find 1. The Kegelmaster, 2. 4 springs made of surgical grade stainless steel, 3. A log for recording your bladder habits, 4. A custom carry case or satin travel pouch, and 5. The instruction booklet. We encourage you to read through the instruction booklet to reinforce what you're going to learn by watching this video. First, let's try putting the Kegelmaster together. You'll find a knob on the side of the plastic unit. Unscrew this knob by turning it counterclockwise. The knob will come all the way off the screw. Set the knob to the side. Now you can open and close the Kegelmaster freely. The bottom is a hinge. The unit does not come completely apart. The hinge is designed to help ensure that the pegs will always line up correctly and easily. When your Kegelmaster is open, you'll notice that each interior side has 4 plastic posts. Each post matches up with one on the other side when the unit is closed. So, starting at post 1, this is post 2, 3, and 4. It's time to add the springs that will give you the crucial resistance your muscles need to tone up. Take any of the 4 springs that came with the unit and slip one over post number 1, the post closest to the hinge. It should reach all the way to the bottom of the post. Fold your Kegelmaster closed. You'll need to guide the other end of the spring onto the matching post in order to close the unit properly. Do you feel the springiness? That's the resistance that's going to help you tone your muscles. While holding the unit closed, screw the knob back into place. Prior to using the Kegelmaster, you'll want to screw the knob down until it stops naturally. If you were preparing for a Kegelmaster session, you'd be ready to go. But before we discuss how to operate the Kegelmaster, let me show you what we mean when we say 15 levels of resistance. First, unscrew the knob about 8 turns. Because of the spring inside, the Kegelmaster now wants to separate. Try closing it and then letting it open again. The effort you have to put forth to close it is the resistance. Right now, with 1 spring on the first peg, you're experiencing level 1 of the 15 levels. That's exactly where you're going to want to start when you begin using the Kegelmaster. But with consistent use, it won't be long before you're ready to move up to the next level. The instruction booklet lists the various tension settings in order from the least resistance to the highest level. Basically, we achieve greater resistance by adding springs in different positions. So, for instance, when you've completed level 1 and are ready to move on to level 2, you're simply going to move the single spring from peg 1 to peg 2. To remove a spring, simply hold onto the side of it while opening the unit. Use care when removing the springs, especially from peg 1. Part of what makes them such a great part of the device is their springy nature. You don't want them to go flying. Then, move it up 1 peg. Remember that the springs are always going to be on matching pegs. That means you never want to use a spring to connect peg 1 on one side with peg 2 on the other. As your muscles get more toned and you move up through the resistance levels, you'll need to consult your instruction booklet for proper spring placement. You're going to be using different combinations of springs on different pegs, so you don't want to just wing it. Now that you understand how the Kegelmaster is put together, let's go over how to use it. Before your first use, you'll want to hand wash it in warm water with a mild soap. The knob and springs are made of surgical grade stainless steel. The first step is to add springs to match your current level of resistance. Today, we'll start with 1 spring on post 1. So, just open the unit, place a spring on the first post, match it up with the other side, and close the Kegelmaster. Screw the knob on so the 2 sides are touching. That means the Kegelmaster is in the closed position. Find a position that's comfortable for you. Most women like to lie on their backs with their knees bent and their feet flat, about 2 feet apart. Lubrication is a crucial step because it makes insertion and removal easier. You'll need a water-soluble, not an oil-based lubricant. Lubricate the vaginal area and the first 3 inches of the Kegelmaster, from the tip to what we call the flare. You're never going to insert the unit more than is comfortable for you, and never past the flare. Be sure that the unit is completely closed, and then insert it, knob side up, into your vaginal opening until it's firmly in place. It's designed to stop automatically at the flare. Now, at this point, some women feel the natural urge to do an abdominal push, but this isn't a Kegel exercise. In fact, it can even cause the Kegelmaster to slip out. So, to prevent this, use your hand to hold the unit in place until you are comfortable doing proper Kegel contractions. The motion you'll want is a squeeze, not a push. With the Kegelmaster inserted and the knob loosened to allow for resistance, you're ready to begin your exercise program. Try using your vaginal muscles to squeeze the Kegelmaster closed. Focus only on using your vaginal muscles, not your abdominals or gluteal muscles. Count to 2 and release. If you're able to move the Kegelmaster, you're on the right setting and you're doing the right exercises. But if you aren't getting movement, you need to try reducing or increasing your resistance until you feel pressure against the vaginal opening. Remember, you don't want to try too many springs at first. The idea is to get as much movement from the Kegelmaster as possible. And it doesn't have to close completely to benefit you. You can do as few or as many sets and reps as you wish, but we typically recommend 3 sets of 30 contractions. You can count 1, 1, 2, release. 2, 1, 2, release. And you can monitor the base of the Kegelmaster and feel the unit closing. When you've finished, tighten the knob by turning it clockwise until the Kegelmaster is in the closed position, and then gently twist from side to side and slowly pull straight back until the unit is removed. Remember to hand wash your Kegelmaster with a mild soap between each use, and make sure it's completely dry before you put it away for the day. Well, those are the simple steps that are going to help you get your muscles back in shape. It only takes minutes a day, but using the Kegelmaster can change your life. If you've purchased the Kegelmaster to help with a urinary incontinence problem, we recommend that you photocopy the bladder habit diary and use it on a weekly or monthly basis to track changes in your bathroom habits. Now, I'm going to answer some of the most frequently asked questions about the Kegelmaster. Who should not use the Kegelmaster? The Kegelmaster should not be used during the first 6 weeks after giving birth. However, some pregnant women use it to help prepare for childbirth, but always consult your physician first. Also, women who have had genitourinary or any other pelvic surgical procedure should also wait 6 weeks before using the Kegelmaster, unless given specific instructions by their physicians. The Kegelmaster shouldn't be used simultaneously with intravaginal devices such as tampons, diaphragms, or pessaries. How will I know it's working? During use, you'll know the Kegelmaster is working because you'll feel the unit contract. In your daily life, you'll know the Kegelmaster is working because you'll experience a reduction in urinary incontinence and increased sensation during sex. How long will I need to use the Kegelmaster? Your pelvic floor muscles are like any other muscle in your body. If you leave them alone too long, they'll become weaker or atrophy. So, even once you've treated the condition that you originally bought the Kegelmaster for, it can only help to keep using it on a regular basis. It's very important to remember to use the Kegelmaster every day at the beginning of your exercise program. Once you've achieved the results you want in alleviating incontinence or achieving increased sensation, then you can determine how often you need to use a Kegelmaster to maintain the health of these important muscles. Can the Kegelmaster open too wide inside my body? As long as you're comfortable and you can use your vaginal muscles to contract the unit, you don't need to worry about the Kegelmaster being open too wide. Stretching is actually good for the muscles. Just be sure you control the settings so the Kegelmaster never causes you pain. And the Kegelmaster will never make the vaginal area larger or stretched out. What if I experience spotting while using the Kegelmaster? A small amount of spotting, especially for women who are menopausal, postmenopausal, or have been sexually inactive for a long time, is normal. Continued use of the Kegelmaster will strengthen and tone your muscles and will eliminate the spotting. If you experience extended spotting or more intense bleeding for more than a week, discontinue use and consult your physician. Pregnant women who experience spotting should discontinue use until advised by a doctor. If you have more questions, call the toll-free number you'll find in the instruction booklet, and a female customer service representative will be happy to talk to you.